Hello, I am Dr. Renato Perorena, President of the Spiritist Medical Association of Uruguay, and on behalf of the International Spiritist Medical Association, it's an immense pleasure to introduce Dr. FABIO VILLARRAGA, who will continue the program of this first virtual Congress of the International Spiritist Medical Association with a talk on the contribution of Spiritism and the discussion of the bioethic dilemmas related to the pandemic. Dr. Fabio Ricardo Villarraga Benavides is a surgeon, a graduate of the National University of Colombia, who has worked as an attending physician at the Regional Hospital San Rafael of Factativa for 30 years, and currently he's part of the program of humanization. He's a member of the Spiritus Association Senderos de la Esperanza, director of the assistential and supporting programs to pregnant women. He has translated from Portuguese to Spanish the book Happy Life, Joana de Angelis and Divaldo Pereira's Franco, and also the book El Clamor de la Vida from Dr. Marlene Nobri. Dr. Fabio Villarraga is a member of the Executive Committee of the International Spiritist Council, and he is the president of the Spiritist Medical Association of Colombia, SMA Colombia, and president of the Spiritist Federation of Cundinamarca for the period of 2019 to 2022. So, it is my pleasure to leave with you all Dr. Fabio Villarraga. Our warmest greetings to all the audience of the first International Spiritual Medical Congress that the International Spiritist Medical Association is conducting this month. We want to thank the directors of the International Spiritist Medical Association and also the spiritual mentors of our organization, because it is through them that we're working at the earth level for the Spiritist medical paradigm. Today I will share some knowledge regarding bioethics and the Spiritist doctrine and how they relate to each other and how Spiritism addresses these dilemmas within the work of healthcare professionals, and which have culminated in these times of this pandemic that we live in. So, in this talk around the contribution of Spiritism and the discussion of bioethical dilemmas related to the pandemic, we will delve into some of these dilemmas during this first International Spiritist Medical Congress. So, we will deepen into the roots. What is the root of bioethics? How did it start with this notable specialist in the field of oncology, Professor Emeritus of the University of Wisconsin, United States, Dr. Van Rensselaer Potter, who in 1971 published his book Bioethics, A Bridge to the Future. It is precisely in this book that he states that his objective was to contribute to the future of the human species by promoting the formation of a new discipline, the discipline of bioethics. And he continues, if there are two cultures that seem incapable of speaking to each other, the sciences and the humanities, if this is a part of the reason the future seems uncertain, then perhaps we could build a bridge to the future, building the discipline of bioethics as a bridge between two cultures. So, it is Potter, indeed, the pioneer of the field of bioethics, and who coined this term, and who established, as he himself said in this work, the union, the link between sciences and humanities. But to what end? To strengthen the values of these early sciences. Later, in 1978, the Encyclopedia of Bioethics brings a definition a little more specific about the topic and says that bioethics is a systematic study of human conduct in the area of the life sciences and of health, considered in the light of principles and values. Thus, it is correlating here these principles, these values within the field of life sciences and above all, as applied to the field of health. Potter says that obviously bios represents biological knowledge and ethics represents human values, meaning the rescue and preservation of moral values. The same moral values that in Spiritism are presented by Kardec as Christian morals, Christian moral values based on the profound legacy of the Master Jesus of Nazareth. If we remember what Potter said, it unites sciences with the humanities, and this appreciation of human values, moral values, and as Kardec states, as we see in Spiritism, where he tells us that in the evolutionary process of human beings, we need these two great wings, the wing of knowledge, of intelligence, and the wing of morality, the area of conduct that must permeate the evolutionary history and evolutionary development of a human being. Thus, bioethics emerges as a necessity to analyze the serious problems that technological development and the loss of human values have created. Just as an example, let's remember what happened in the Second World War with several experiments with human beings that were made by physicians, healthcare professionals, who experienced on human beings under a total loss of values within the framework of the great Second World War and all the abuses that occurred. Thus, it is necessary, as Potter said, to establish precise guidance within the field of ethics of life, bioethics. Thus, it's also necessary to state that bioethics is non-denomination, meaning that it's not identified with any particular creed because it is open to an ample dialogue between different thoughts and ideas, but also has a multidisciplinary characteristic because given the complexity of the topics it deals with, it is necessary the contribution of different professionals from different areas, from healthcare, professionals in other areas, to be able to establish consensus, ethical consensus, behavioral consensus that help guide the conduct of individuals and of humanity in the face of certain situations. So we can establish a parallel between Professor Kardec and Potter, the professor emeritus at the University of Wisconsin, a specialist in the field of oncology or tumors. Kardec created several terms in the Spiritist terminology, the main one being the term Spiritism. And Potter also created terms and the word bioethics that embodies this new area of science and knowledge. This is how Kardec began in 1857, creating a whole revealing process for humanity with information conveyed through the system of questions and answers, and first placed in the Spirit's book and subsequently in all the other works of the Spiritus codification, creating principles of a legacy for all posterity, a legacy for all humanity that today we can get, study, and delve in. And as such, Potter too, but more than 110 years later, he also created a series of knowledge, and he reveals the union between science and humanities, the need to establish that bridge, as he said in his work of Bioethics, a bridge to the future, establishing an important foundation on which all the world's major bioethics groups will be formed and the various facets that are known today. So, what topics in the studies of bioethics will be precisely the focus of this talk today? Topics related to the beginning of human life, contraception, abortion, assisted reproduction, in vitro fertilization, etc. Topics that have to do with the conduct of healthcare professionals and often with those who do research, as well as those who perform the procedures in the field of medical practice. So let's remember, as we are talking about the dilemmas of the beginning of life, the concept that appears in answer to question 344 of the Spirit's book, where spirits answer that the moment when the soul joins the body begins at the moment of conception, but that the union is not complete until the moment of birth. This concept, which is a philosophical concept, becomes a moral concept, a scientific concept, because obviously life is a continuum, and a continuity, as we know, starts in the spiritual realm as a very special union, and thus this calls for special attitude of the healthcare professionals, of the medical doctors or colleagues, to deeply realize that if this union begins in conception, there must be a deep respect for life in all its manifestations, including those with deficiencies. It is important to respect life once you get to know the spiritual and spiritual information as it appears in the Spirit's book. So, as we look at this curve of biological life for an existence that begins in conception and ends at the type of death or discarnation, this biologically speaking continuity is a continuum, because the contributions of the father, mother, the eggs, the sperms were living elements contributed by parents, that only a union of these principles with the union of the spiritual principle through peri-spiritual bonds allows for the biological reorganization that is called within that peri-spiritual biological organizing model to give continuity and set the information according to spiritual needs until the end of that existence. Thus, life is a continuum, and we have no right to interrupt it at any time in its existence. Bioethics also studies the process links to the ends of human life, and there are also many controversies, but Spiritism clarifies these issues because it studies the issue of euthanasia, assisted suicide, as it is sometimes called, enabling therapeutic methods to the terminally ill, the right to reject therapeutic measures, the diagnosis of death. All these aspects often create controversy within healthcare professionals, in the family, or even with the patient. Sometimes the patient is the one who has made decisions and has left them established within the autonomy that he or she has. But if we look at the item 28 of the Gospel, according to Spiritism, it clearly tells us, mitigate the last sufferings as much as I can, or refrain from shortening life, even from a single minute, because this minute can avoid many tears in the future. This is actually a guidance of conduct a spiritual ethical guidance, ethical spiritists to follow when facing human pain and suffering at the last instance of life. So what do we have to do? Mitigate these last sufferings as much as we can, tells chapter 5 of the Gospel according to Spiritism. These are suggestions of conduct. They're ethical suggestions. They are bioethical suggestions of a spiritual bioethics that is immersed within the legacy of the Spiritist codification, and that we've brought them up to present this correlation between bioethics and Spiritism. Also among the topics studied by bioethics are those related to the quality of human life, quality versus quantity, the justice of distribution, right to health care, sanitary conditions, in summary, human rights. And it is also within this topic that ethics studies issues related to ecological ethics and demography, environmental pollution, and etc. This is to say that it has to do with the human conduct towards the environment and how they should be governed. And thank God today there are more regulations in many countries regarding these issues. And with these regulations, these laws, they guide the conduct of people to preserve the environment, something that is obviously done using the law, human laws. But from the knowledge of spiritual laws, we're also aware of the manifestations of life at every level of nature. So we read in Genesis chapter 9, item 4, until humanity is perfected enough through intelligence and the practice of divine laws, the greatest disturbances will be caused by men rather than by nature. That is, they will be of moral and social character rather than physical. So we realize that even though there are massive disasters affecting ecology, Spiritism tells us that these catastrophes, rather than caused by nature, will be of moral and social conditions in which humans will still struggle and which need to be adjusted in order for us to move to a new phase within our planetary path in the physical, moral, and spiritual arenas. So these are profound instructions that come as revealing pearls from the Spiritist codification books. Also study topics of bioethics, those related to biomedical research, and it's precisely through the different committees of bioethics, of medical ethics, that exist within institutions through which all research projects must pass through, especially those including patients or patient data. So no longer the decisions are made on a personal base, but result from a consensus or from groups that are formed by professionals for improving safety at all sides. So bioethics then seeks to establish an efficient, practical method of study that allows the detection and the analysis of each of these situations in order to reach conclusions, because it's precisely the purpose of bioethics, to be able to contribute in these conclusions and in the decision-making process, especially to adapt, said Potter, to the moment and the historical circumstances, always keeping in mind the respect for the dignity of life. So that continuum of life must always be respected from the moment of conception to the end of existence, at the time of death, or as we call it, discarnation. What is the methodology that bioethics use? Essentially, the most widely used is the method of principles based on the four principles proposed by these two authors, Tom Beauchamp and James Childress, and which are in the Principles of Biomedical Ethics that was published in 1979, and which constitutes basically four fundamental principles: beneficence, non-maleficence, autonomy, and justice. Principles that allow us to guide decision making and the conclusions that can be drawn in certain cases. So, talking about the beneficence considered as the obligation to do good, when applied to the practice of medicine, it dictates that the doctor has an obligation to do good to the patient, to save lives, to relieve pain and suffering, and to the extent possible, cure the disease. So this principle is well aligned with the same principles that we find in the Gospel according to Spiritism in the chapter about people of goodwill, and that is basically doing good. And there is also the principle of non-maleficence, of doing no harm, that establishes the obligation to do no harm. And the principle that establishes the obligation to do no harm is above the obligation to do good. Thus, this is a principle that is also fundamental to the directing and guiding behavior that may at times emerge in healthcare settings and institutions. This principle also applies to environmental ethics as to ethics in general. And with regard to autonomy, as we know, this principle is related to the respect for the freedom of the patient. And nowadays, it allows that by granting human rights to freedom, to life, to health, patients can choose by themselves and make the decision whether or not to have a certain procedure, a surgery, or an examination that in their consideration or in their perspective or in their own cosmogony, they may or not accept. And so it is well accepted today that we cannot do good to a patient against their will. Many cases exist, and for example, in our hospital we have had cases in which patients needed surgery and they decided not to be operated. And obviously, we have to make decisions about the situation because the patient has to be well informed about the risks that certain decisions entail. Similarly, those who by their convictions or by their religious concepts do not authorize blood transfusions, for example, knowing that it's necessary, many times they put their lives at risk. However, as they make this determination, they are obviously exercising their right to autonomy. The doctor's obligation is to clearly inform the patient about his or her situation and the alternatives that they can offer, and the benefits and the risks. And the patient, however, has the right to agree or not to undergo a particular diagnostic or therapeutic procedure. So within the medical ethics, the will of the patient must obviously be respected. Within this principle of justice, today's medicine increasingly demands a search for fair health policies that ensure adequate and medical attention to the majority. What we would all like is perhaps regulations applied to resources. Surely, often the resources are not sufficient to cover the whole population. And that's why the issue is considered to be under the guise and competence of the state and the health administrators, but also to the doctor who has the obligation to ensure decisions that are proper for a rational use of these resources based on strictly on a cost-benefit analysis. What for? So that this management of resources can be balanced and fair for all. And now, let's remember the concept of justice from the Spiritist doctrine. What's that concept? Kardec asked very specifically in the Spirit's book, question 875, how can justice be defined? And the answer was concrete. Justice consists in respecting the rights of each individual. This is another principle of conduct, another principle that speaks about the concept of justice applied to all human attitudes and conducts in relation to others, because this principle of justice applies to the respect that one must have to all other human beings. So, just as we want to be respected, we must equally respect others' rights. Thus, bioethics, to achieve its objectives, promotes the development of committees, and there are ethics or bioethic committees in institutions to which all research projects under developments must go through. Similarly, there are ethic committees in different types of business, and they must exist even in the political sphere also. This is a norm nowadays. Why? Because it has to do with the ethical behaviors of humans that affect the rights of others. And therefore, it's necessary to establish these frameworks of reference in order to establish principles of action within society. So, healthcare workers are often faced with multiple circumstances in which they have to make decisions, and some decisions are related to aspects that often put them in a situation of uncertainty, of concern, and sometimes of feeling alone when making decisions when they're in isolated places, when they're in more remote health institutions. But confronting these situations, there's always the resource of faith. Dr. Bezerra de Menezes says in a message given through Divaldo Pereira Franco that disease can be considered as a thermometer of faith. And this applies to the healthcare worker as well as to the patients, their relatives, and the administrators, to everyone. Because in reality, if we have sufficient faith, as we read in the Gospel, we'll be able to stand face to face with reason in all human acts. So, very wisely, Dr. Bezerra de Menezes says that this faith constitutes a thermometer, and we can precisely say faith can be measured by the way we take the disease or the strength of the disease. That is, if we have deep enough faith, not only human faith, but divine faith, as written in the Gospel, we are able to face all the situations, including the current pandemic. Therefore, the ethical dilemmas arise when we have to decide between two options, which are equally acceptable, but neither is preferable to the other. Here we'll discuss a hypothetical case that can occur in many circumstances, in many countries. And this is the case, for example, of Joseph, an 81-year-old patient, diabetic, hypertensive, a retired engineer, grandfather to 5 children with severe COVID pneumonia. He needed to be admitted to ICU to be intubated. But on the other side, we have Patricia, who is a 40-year-old single mother, street vendor, with no previous chronic illness, with 2 children of school age, and it's the same clinical conditions as Joseph. She has severe COVID pneumonia, and she also needs to be admitted to the ICU to be intubated. But there's only one bed available in the hospital where we are working, and there is no other hospital nearby to which we can refer them. Then the question now, for everyone in the role of a healthcare professional is, which patient would you admit? Under what criteria would you decide between these 2 cases? Since based on the right to life, they both have the right to live. And if it is by the rules that many times govern health services, it will obviously prevail those who have less comorbidity and who have a better prospect of life. But there is a dilemma when healthcare professionals have to make these decisions, when there are underlying responsibilities of the state government, of the healthcare system, of all those who manage healthcare resources, who should make them well utilized, so that in decisions everyone should be given the same options and not be deciding who does or who does not need a ventilator or intensive care unit. An intensive care bed should be available to everyone. So we see that when these dilemmas appear, the bioethic methods obviously help in decision making. Often patients under their own autonomy have already signed some document where they state, if I am in certain conditions, please do not intubate me. If it has been previously expressed, then there is already an autonomy right that must be respected, especially if the patient has expressed it in writing. Also, obviously, the principle of beneficence seeks the best benefit for the patient and, above all, do no harm at any time. But for this, we obviously need that the resources are enough for all, and that there is no need to decide at a given time for one or the other. Because when we decide for one, we benefit one but do not benefit the other. And thus we will be doing indirect harm. Then we have to add the principle of justice, because it talks about the fairness of health policies that seek coverage for all. However, we do not yet have the perfect health systems in our countries where the coverages would be really for all. Even in European countries that have just passed through this pandemic and are having a second wave, the intensive care units were filled to full capacity, especially in Spain and Italy, because the exponential curve caught them unprepared and they had to face many difficult circumstances, deciding between life and death in different cases that very painfully became known throughout the world. The psychiatrist Dr. Luis Pintor, from the Psychiatrist Services of the Hospital of Barcelona, professor of the Master's Program in Bioethics and Master's Programs in Neurosciences, says that these dilemmas generally occur with regard to admission to the ICU are the most critical, but that obviously nowadays they are regulated by protocols overseen by ethical committees, and all this have been of great help for those who ultimately make decisions, so not to do it isolated from others, but through a group of professionals, as it is done in the Hospital of Barcelona where he works. But this specialist in psychiatry also makes it clear that in the desire to cure, that is to practice beneficence, we can arrive at a conflict with the ethical principle of non-maleficence, so do no harm. Why? He said that he himself had to treat pharmacologically behavioral alterations of patients with COVID without being able to perform an exhaustive in-person evaluation because he would become a vector of transmission by visiting both COVID and non-COVID patients. And also because in the first weeks of the pandemic, there was a shortage of the professional protective equipment. So this has obviously created dilemmas in the action of individual professionals because while they could do things more professionally, the circumstances limited them therapeutically. And he says that by the eagerness to benefit everyone, they could do no harm in the event that they became vectors of the virus within in the hospital. So they had to follow the biosafety standards that are mandatory to all healthcare institutions. But this creates an internal dilemma for the healthcare professional who was taught to work at their full professional capacity. Because there are times when you cannot fully evaluate a patient, as in the case that the psychiatrist mentioned. So, in institutions, health services, for example, in Colombia, our country, specific recommendations were created for ethical decision-making related to COVID-19 pandemic. For example, those who have been in place since March 2020, many of them are endorsed by international studies published in scientific journals, and we see that they were based on principles of bioethics for not harming, for benefiting the patient, and also to act fairly and to maintain professional integrity. It also recommends the providing of information of possible limitations on access to the necessary support, including, in the current context, resources that may be tragically limited, but with no implication to abandonment of the patient. This should be done from the beginning when speaking with family members and relatives. It also states that there must be a priority when treating those who benefit from the treatment and to ensure relief and support those who would not be able to receive specific treatment. So this difference is established because there's certainly a limitation in the health system. Patients with severe diseases who will be unable to benefit from advanced care, as well as those who receive the required advanced support without the possibility of recovery, even when they arrive to intensive care first, they may be subjected to an adequacy of therapeutic efforts to allow the care to be given to others. In the end, it is saying that if necessary, you have to move those resources that support the treatment of one patient to another, provided that in advance, at the time patient of admission, it is informed that if necessary, this will be done. This rule set by the Ministry of Health here in Colombia, fortunately has not been applied because our health system, in terms of bed units in the intensive care, did not reach its maximum capacity, and we are already on the plateau and starting to decrease. However, regarding the patients who have comorbidities, we don't know who will survive, will overcome all the conditions, as there are factors of which we're not aware in this plane of life. This is the case of a 104-year-old patient who survived COVID-19, and you see the photo of the day he left the hospital after remaining intubated in intensive care unit. Yet, despite all the risks and comorbidities, and above all his age, he survived COVID-19. So we know that under this concept that we find in Spiritism, there is a vibratory affinity with different pathogens. In this case, the coronavirus pandemic, of the virus with a deficiency that the immune system may have, and a vibratory affinity that exists in the perispirit corresponding to the underlying spiritual needs that the person may have when experience a serious form of disease. So that's why in the public health service in different parts of the world, they discuss protocols that aim to take part in decisions on allowing or not admission to the intensive care units, and then discussion about comorbidities and chances of surviving the disease, depending on the degree of severity and depending on the requirements. However, it also makes very clear there should be no prioritization by administrative indication or individual recommendations by third parties, meaning there should be no administrative party or people from the political circle giving orders and making choices regarding patient admission in the ICUs at the time of decision and on the circumstances. This triage, this prioritization cannot be done by an administrative party. This is also supported by international publications. And finally, within these general recommendations on ethical decision-making, the Ministry of Health states the need to redistribute and allocate resources as ventilation support must be done with clear parameters previously defined that allow us to prioritize proportionally their allocation and which have to be respected by all. So obviously, there are consensus for the criteria of adequacy, of relocation, of therapeutic in case of clinical deterioration. That is, when clinical deterioration occurs, all parties related to the patient, family, representatives, and other members of the care team should have been clearly informed by the time when these therapeutic efforts have to be withdrawn. And this should be stated in the protocols and documents from the health service. Naturally, these protocols are not written under moral criteria or even less spiritual criteria. Otherwise, it would have other characteristics. So we realize that the human rules, those we have already talked about, those of the health services, the protocols, have a number of principles of situations on which are based on the conduct of healthcare professionals, but we must not lose sight that above those human rules would always be divine laws that govern the outcomes and the future of the patients and even the natural course of diseases and illnesses as they change over time. Those who we thought would not die end up dying, and those who by statistics have the most limited and dark prognosis end up surviving. So we understand that the pandemic, in this case the coronavirus, is governed by the divine law, immersed within the process of planetary transition, and it's attuned, although we may not see it in its entirety in relation to the law of justice, love and charity, that is, within the divine goodness and justice. It is certainly framed within the spiritual immigrations of which the book Genesis, and that everything is with a potential planning that God has for humanity, and in particular a period that humanity is going through. So, to face ethical dilemmas, we not only need knowledge of human regulations, protocol, laws, but we also need a moral foundation that can support knowledge, which supports our daily actions and work within our standards of institution conduct and field of health. This is what chapter 5 of the Gospel according to Spiritism states. In that paragraph of instruction of spirits, that blessed are those who have had the opportunity to prove her faith, determination, perseverance, and submission to God's will. And these are valid for patients, for healthcare professionals, for family members, and everyone in general. Because in face of all these circumstances, many of us have to show determination, perseverance of our faith, and our submission to divine plans. And in those dilemmas related to the end of life, what to do when the capacity of a country or a region's health system is saturated, as it has happened when we have to choose between one and another. What are the prevailing criteria for deciding the designation of ICU beds? We have those rules determined by the healthcare system, but they're based on technical or scientific criteria, not moral or much less spiritually based. Let us question ourselves why patients with COVID-19 often die alone, only in the company of strangers who perform resuscitations at the end of their existence. Also, attending to funerals is a process that we know nowadays is governed by sanitary rules, which are or rank higher than family decisions. So we have to explain to the relatives sometimes why they cannot mourn the body of their loved one, that they cannot see it, that they cannot touch it. In this process of humanization of the hospital where we work, we have been asked to explain to relatives that they can no longer see their loved one, and many of them cry and tell us, please, let me see my mother. Please, let me see my father, my grandfather, my wife, my son, who has died and who they have not seen for the last time. Because from the moment they entered the COVID unit, they were isolated from visitors and from relatives. And that is very lonely. And let's say a circumstance that plays a role in these existential experiences that COVID patients have and that often die alone, they're away from their families. So another dilemma is in relation to the environment, and perhaps many of you have not started to think about the elements of personal protection, the impact on the environment. How many millions of masks are discarded daily in the trash? How many non-degradable plastic containers are they removing in nature? What is the impact of these elements and others on the other living species of the realms of nature? This is a publication that came out in June of 2020 from an exclusive magazine dedicated to environmental issues, where they talk about the impact of the use and management of plastics in this period during the pandemic, and they tell us that there are billions, in this case 129 billion masks, that are thrown, discarded into the environment, and 65 billion gloves that are going to be discarded also, and they can also be found on beaches, in the seas, in rivers, in different places. And for all who want to read, they can go to this reference, this link, and see this video that shows how they're collecting different quantities, thousands and millions of masks, or different qualities in different parts of the world, and different beaches, different places of the sea. This is our responsibility. What is our ethical approach, and how does the much needed use of these elements of personal protection are balanced with environment preservation? That's also an ethical challenge that we must solve. And regarding the problems of the beginning of life, what happens to the intrauterine baby if he or she gets COVID? What to do if the mother is nursing but she's positive and the baby is negative? There are myths and realities of these situations. If the mother is COVID-19 positive, should she stop breastfeeding? The World Health Organization says no, breastfeeding cannot be suspended even in these circumstances. Hygiene measures should always be applied. If the mother is sick with COVID-19, babies are infected in the womb or through breastfeeding. This is the myth, and the reality is that so far there is no evidence to suggest that COVID-19 is spread to babies during pregnancy or through mother's milk. And finally, there is a myth that if the baby is sick with COVID-19, it cannot receive maternal milk. The mother must continue breastfeeding with the necessary hygiene measures. But if it's unable to breastfeed, breast milk can be removed and offered in a cup or a spoon, as recommended now. So here's an expert in this field, Dr. Alejandra Gaviria, rector of the University of the Andes, who is a Minister of Health and who is a member of the Lancet COVID-19 Commission, created to help accelerate global equitable and lasting solutions to the pandemic. He says that the human species is not in danger because of the pandemic, but there is much suffering at stake, some inevitable, some not. The wide global debate in all the countries and communities of the world revolves around the policies or actions necessary to minimize that avoidable suffering. This is why it is important to minimize the unavoidable suffering. And he says that governments now face a more difficult decision, which is not between life and the economy, but between deaths from coronavirus and deaths and lives ruined by poverty, other diseases, hunger, overcrowding, and the psychological consequences of many months lockup. Harvard University specialists have spoken about these prolonged quarantines, claiming that they do more harm than good, which increase avoidable suffering and undermine equity and social justice. And finally, Dr. Gaviria states that any ethical position requires compassion in all cases. Compassion, that's a human feeling, a virtue that has been considered nowadays in the therapeutic fields. That's also referred in our work, Umbre, and in the moral from the Gospel according to Spiritism. And in chapter 13, that speaks of the hidden misfortune, it tells us that in the vast calamities, charity manifests as generous impulses to repair disasters. But next to these general disasters, there are thousands of other disasters that go unnoticed. So, are we really mitigating those hidden misfortunes as we face all that pandemic situation and the news that we see every day? Let's ask ourselves right now, if we have the chance to mitigate these hidden misfortunes, we should do it. To end, we will place here these principles of the principalist bioethics, and above all relate them to the Spiritist bioethical model, because the principalist bioethic considers the person as a whole with deep respect for life and dignity, regardless of the age or health status of people. Abortion, infanticide, euthanasia are all ethically unacceptable, but for the utilitarian, pragmatic system, they consider only a person those who may be self-aware and not embryos and fetuses, newborns with severe neurological deficiencies, or even comatose patients in vegetative states. For this system, abortion, infanticide, embryo manipulation, and euthanasia are justified. Therefore, we bring for a final conclusion the bioethical spiritist model proposed by Dr. Marlene Nobre in her work The Soul of Matter in 2003. She says that in this model, one should consider the person as a transcendent being, multidimensional in nature, and have a deep respect for life. It is what she calls the Spiritist personalistic model, which is based on the fact that we are divine creations. We are part of an evolutionary model. We are immortal spirits, and so are all living beings. And that through the evolutionary process, we find an individualization of the intelligent principle. This is all based on the Christian moral principles and in this spiritual bioethical model that Dr. Marlene left in the book, The Soul of Matter. So, correlating the bioethical principles with the moral laws of the Spirit's book and with the Christian principles that are in it, the Gospel according to Spiritism, we can say that both beneficence and non-maleficence, that is to do good and do no harm, are framed within the law of justice, love, and charity, which is the law number 10 of Book 3 of the Spirit's book. All these Christian principles, to love one's neighbor as himself and to do for others what we would like others to do for us, and the principle of autonomy as well, where it is independence of decisions adjusted within the moral law, the law of freedom, and the Christian principles of the care of the body and the spirit for people of goodwill and mission of Spiritists. So, to culminate with the principles of bioethic justice, equitable distribution, underpinned and correlated with the law of equality within the moral laws and the Christian principles of doing good without ostentation and detachment of terrestrial goods. So this decalogue, medical spiritist nature, received by Dr. Marlene in a message in October of 1968, tells us in item number 10 the following. And this is a message for all of us. Above all, practice medicine with a divine meaning, recognizing yourself as a child of God, as a servant of the Creator, and therefore as a humble servant of the sovereign truth. It's thus for all physicians in divine sense, as André Luis, Dr. Bezerra de Menezes, but above all, this great doctor of souls and bodies, our Master Jesus of Nazareth. The book Jesus and the President says, Jesus remains current not only for the therapies of love and the teachings he proposes to contemporary men, but for the peace he radiated and the love that he taught us through his therapeutic legacy. And that these teachings that Jesus has bequeathed us through his witness of life and his encouraging and therapeutic messages, that from his time to today, even so far, we still seek to understand, to seek the true healing of our souls. Thank you very much to all of you at this first International Spiritist Congress of the International Spiritist Association. Thank you very much. Dearest Dr. Fabio Villarraga, I'm sure if we were in an auditorium, all the participants will be standing and applauding you, because your presentation couldn't have been more appropriate for the time, more clear and eloquent about the magnitude of the importance that these bioethical issues have at the present time. You also have the ability to wrap it all up in the end making a parallel between Spiritism and bioethics, the moral laws, and the Spiritist principles. Anyways, this is all I want to say. On behalf of the International Spiritist Association, I am infinitely grateful for the brilliant talk you've delivered, and I appreciate the opportunity to have introduced you in this opportunity. Thank you very much for your talk and your presence today. Thank you very much.